Hello, my name is Cordell and I'm here with Jana Luces, who is going to be my patient. I am going to be conducting a head-to-toe assessment. She has given written consent to make a YouTube link and upload this to send to my professor. We have written consent. I just want to confirm, do you give verbal consent as well?
I do.
Okay, so I am just gonna show you the room so that you know that there are no notes. It's in my living room. I'm gonna show you the floor. This is my eye chart and my equipment, and I would be starting to begin my history. Jana Luces, could you verify your date of birth for me?
29/35, 78.
Okay. What's your race?
Black.
Okay. Could you verify for me your reason for visit today? You here for an annual visit?
Annual assessment.
Annual assessment. Okay. So a brief history is that Jana Luces is a African American female, 44 years old, who has come for an annual assessment. She has seen the doctor at this practice before, or providers at this practice before. She is here for screening. She does have a history of high blood pressure, and she is on medication that is currently working well for her. She had last year her screening for regular CBC, routine CBC, routine lipid profile, metabolic profile. Her pap smear was done 6 months ago.
Yes.
By her OB/GYN, and she had her no mammogram yet, right?
No.
Okay, no problem. So I am now going to start asking her about her past medical history, and we would be moving from there. So, do you have any past medical histories?
Hypertensive.
Okay, and do you know when you were diagnosed with this?
2015.
Okay. Do you take any medication for this?
Yes, I do.
Okay. What do you take?
Lisinopril.
All right, and you know how many milligrams?
10 milligrams.
10 milligrams. Is it once a day, twice a day?
Twice a day.
Twice a day. So you do like a Q12 or morning, night? How do you take your medicine?
12 hourly.
12 hourly. Okay, no problem. And it's working currently for you? You have any complaints?
Yes, it is.
Okay, all right. So, have you had any surgeries in the past?
No.
Okay, were you ever admitted to the hospital?
For delivery of my 2 children.
Okay, all right. And did they require overnight, or did you require any interventions?
Just regular monitoring.
Okay, and these were vaginal deliveries?
Vaginal, yeah.
Okay, all right. Do you have any allergies to medicine?
No.
Latex or food?
No.
Allergies. Okay, thank you. Do you have any infectious disease problems like
No.
hepatitis? No, okay. HIV or anything like that?
No.
All right. And do you have any, do you use any recreational drugs?
No, I don't.
Do you smoke or drink alcohol?
Alcohol occasionally, I don't smoke.
Okay, and occasionally is like how often?
Just on occasion, very rare.
Okay, and at any time do you have maybe 1, 2 drinks on an occasion?
Maybe 2, 3.
Okay, no problem. Thank you. And social wise, who do you live with?
I live with my 2 children and my husband.
Okay, and are they like, any firearms,
No.
cameras? Are there any safety issues in the community?
No.
Okay. And what about any special religious beliefs?
No.
Okay. moving forward, do you have any, say, I would say like immunocompromised disorders, like lymphatic bleeding disorders? Okay. Um, do you mind if I go into family?
No problem.
Okay, so family history, we're gonna start with your grandparents. Did your grandmother have any past medical history?
Diabetic, hypertensive, angina.
Angina. Okay, and your grandfather, past medical history?
Diabetic and hypertensive.
Okay, and your mother?
Diabetic, hypertensive.
Okay, and your father?
Hypertensive.
Okay. You yourself do have high blood pressure. What about your children? Are they healthy?
Yes.
Okay. No siblings? Any past medical history?
No.
Okay. Um, Now, so your ADLs, which is your daily life, do you have any special activities, hobbies? What do you do for fun?
I exercise every day.
Okay.
Do a 2 mile walk every day.
Okay.
For fun, just occasional on my off days, socialize with friends.
Okay. Okay. So I would like to find out when was your last menstrual period?
2 days ago.
Okay, and are you currently sexually active?
Not at the moment.
Okay, no problem. I would start to move with a system review. Okay, and currently, are you feeling like you forget anything?
No.
Waking up with headaches or dizziness, blurred vision?
No.
All right, and that would be neuro, and we're moving forward to ENT. Okay, and do you have any discharge from your eyes?
No.
I see you have corrective lenses. Have you seen the ophthalmologist or optometrist recently?
Yes, I have.
Okay, and your eyeglasses are working for you. You have no problem with that.
No.
All right. Did you get any like eye pain, blurred visions, discharge from your eyes?
No.
All right. Any congestion, runny nose, or anything like that? Feeling like you can't breathe through your nose?
No.
All right. And throat wise, do you have any sore throat, discharge, burning, cough, swollen tonsils or nodes?
No.
All right. And hearing, do you feel like you have any problems like discharge from the air, hearing, problems, tingling, any soreness?
No.
Okay. Okay. Neck wise, do you have any problems with your neck, rotation,
No.
pain, tenderness?
No.
Okay. Cardiovascular wise, do you have any palpitation, racing heart rate, feeling like your heart is beating out of your chest, any STEMIs in the past or anything like that?
No.
Had to be hospitalized for rapid heart rate?
No.
Okay. All right. And respiratory wise, do you feel like you lose your breath, short of breath, anything like that? Coughing?
No.
All right. So muscular wise, do you feel like you lose your strength, you're off balance or anything like that?
No.
All right. And are you able, any pains at your joints?
No.
Okay. Gastrointestinal wise and stomach wise, do you have any cramping, pain, constipation, diarrhea?
No.
All right. And GU, for you, do you have any like burning on urination, leakage?
No.
Okay. All right. And lymphatic wise, for your breast tissue, do you feel like firmness? One is harder than the other? Any discharge from the nipples?
No.
Okay. Thank you. I'll be moving forward into the exam of the head and skin. Okay, and in doing so, I am going to stand on the side so the cameras could actually see me, and I'm going to stand and I'm going to currently inspect your head, and I'll be inspecting the head to see hair growth. I'll be inspecting actually to be able to identify if there was any infestation, if there was any loss of hair. All right. I'll be looking at her face to see if it's asymmetric, if there's any swellings, if there's any rashes or lesions present. And I'll be looking at her face to see if there was any growth. She currently has what we would say a moles on her face, or birthmarks as well, but nothing that looks like it's overgrowth and a concern at this time. I will now palpate your head just to feel if there's any sinks, mass, growth, development, or clusters. Okay. And may you remove your glasses. I would just like to feel your temporal arteries. Okay, and I'm going to actually press on your frontal sinuses and your maxial sinuses. And do you have any tenderness or pain when I put pressure on it?
No.
Okay. And I'm just gonna look from side to side. And now I am going to move to her eyes, and I'll be looking at her conjunctor, and it's nice and it's pink when you look on it. You look to see if there's any, the eyes are aligned. You look to see if there was any discharge. You would actually inspect to make sure that the sclera is actually white. And I'm going to now move forward into looking to see at her red reflex. I'm also going to be looking at her retinal. Okay, so on this side, I'm going to go eye to eye with you. Okay, and I'm going to move to this side so I can perform it bilaterally. Okay, and I was able to identify and see the disc in her eyes. I was able to look and see at the retina and the vessels. I was able to see that there was no increased growth, marking, or concerns for vascular disease at this time. I am now going to be able to do a pupillary check. So I'm going to sit for this, and I want you to look straight ahead for me as I do a pupillary check. Okay. Okay, and her pupils are reactive to light. They're a size 3. Now I'm going to be looking at this object that's far away, and I'm going to be checking for accommodation and coordination. And you could now see that with that accommodation, you were able to see the pupil actually constrict as the instrument got closer to her and the eyes were focused on it. All right, so I'm going to actually, this is my eye test chart, and I'm going to ask her to actually read for me where it's most comfortable for you. Okay, you do it with your correction lenses. Okay, and could you read for me? I'm going to just put it to the side. Which line works for you? Is it 2020, 2025, 2030?
Below 2020.
Okay, so the first line. Could you read it for me?
LEFODPCT.
Okay, and could you cover one eye for me at a time? Okay, and could you repeat that? Is it the same level?
Yeah.
Okay.
Lefodpct.
Okay, thank you. And could you do the next one?
Lefdopct.
Okay, very good. Thank you. And what I'm going to do is I am going to ask you to actually focus on this, and we're going to be checking cranial nerve 3, 4, and 6 for movement and control of the eyes and the optical. So I want you to focus. Don't move your head, just move your eyes with the objects, okay? Okay. And that would give us the function of the cranial nerve 3, 4, and 6, okay? I'm now going to perform a sensory test of the face for dull and or pointy and soft, okay? And please tell me, close your eyes and tell me what I'm touching you with.
Something soft.
Okay.
Pointed.
Okay, and I'm gonna do the same side.
Soft. Pointed.
Okay, and this is the sensory of the face, and this is cranial nerve 5. Okay, so moving forward, I'm going to look at her ears, and we're going to be looking at bilateral. We always compare both, and I'll be looking for the outer ear. Okay, and I'll be looking and inspecting to see if there was discharge, redness, if there was deformity, or if I see that there was like blood or anything that was coming out. And I would do the same on both ear. Okay, I would be asking her if she had any pain or discomfort, which we did in the beginning of the video, before I do the initial ear exam. Okay, I'm also going to be testing Bren test, which is the conductivity of bone to air conductivity. And what we will be doing is we'll be assessing if she can still hear after bone conductivity. Okay, so I'm going to hit this. I'm going to put it on your bone. You're going to feel the vibration and hear the ringing. When you stop hearing the ringing, I'm going to move it to your ear. Please let me know when you stop hearing them, okay?
Yes.
Is that okay?
Yes.
All right, thank you. Okay.
Stop.
Okay, and could you still hear it?
Yes.
Okay. And this test will be done bilaterally to check if there was hearing. This is cranial nerve 8. Okay. And just for time purposes, I do not want to do both, but I'm just saying it's going to have to be done if you're testing somebody that may have some form of ear trauma or hearing loss. Okay. So now I'm going to actually use the otoscope and look into her ear canal and also look at the drum. For safety, I am going to move this away and be able to focus. And for safety, I'll be holding this, pull the pinner up, okay, and away. And we were able to visualize the eardrum, sorry. Okay, and I'm going to do the same on the other side. Okay, and you will do a safety that your hands are here holding in case somebody it will not go and puncture the eardrum. So her ear canal is nice and pink. Her disc and her eardrum, the middle ear, is actually pearl gray and shiny, no bulging, no fluid is seen, no redness. And at the right ear we see a 5 o'clock mark, and at the left ear we see a 7 o'clock mark, which is normal. I would like to do one more hearing test if possible. May I continue? Okay, and I'm just gonna include your ear and tell me what you hear. Apple.
Apple.
Okay. Apple.
Apple.
Okay, and that would be a test to hear if she was able to hear and if there was a like hearing loss. Okay, could you hear this?
Yes.
Okay, and could you hear that?
Yes.
All right, and that's also like a test to see if they could hear and the vibration of the wave traveling through the air. So I would like to now look at your nose. I'll be inspecting the outside of the nose, the shape, if there was any discharge, if there was redness, if the septum was fine, and we would be moving forward with that. And let me just gather my otoscope. Sorry about that, I dropped it. Put my light on. Okay, sorry about that. Your little system. Okay. Okay. And I'm just going to actually look into the okay, and I'm fixing the otoscope and sorry about that. Okay, and now I'm actually going to ask you to lift. I'm going to kneel so I could look into your nostrils, come down to your liver. I'm able to view the septum and also the nostrils. You want to make sure the septum is aligned, and the nostrils, you would be looking to see if there was like dry blood, if there was any bleeding recently, or trauma or inflamed. May I look? If allergies are present or there's a chronic condition, it is possible that you may see inflammation. May I see? Okay, thank you. And I would like to do cranial nerve one examination, which is smell. Could you close your eyes for me? Okay, and could you occlude one nostril? Okay, and could you tell me what it is?
Peppermint.
Okay, and could you occlude the other nostril?
Peppermint.
And it is peppermint that she is currently sensing, and that's cranial nerve 1. So now we move forward to the mouth, and we'll be looking at the outer lips to see if there was any cracks, if there's any she currently has a mole on the tip of her lip, but the lips are moist, they're not dry or cracked. Can you open for me? See, so I'll be looking at all the teeth. I will be looking with my pen light, and I'll be examining. I'll be looking at the gingiva, and I'll just be pulling down. Okay, and I'll be looking at the soft palate. And Could you stretch your tongue out for me so I could look at your uvula? And I'll be looking at the uvula and tonsils, which currently the uvula is centered. The tonsils actually are two, and they are not touching each other, which is great because we're not concerned about airway obstruction. Can I just look at your mouth one more time, just looking at the outside to see if there's any lesions, if there's any cavities, if there was any implants. I'm just going to do what we call a guard test, which is cranial nerve 9, 10, and 12. Okay, and I'll be looking. Can you open for me? Stretch your tongue out. Okay. Okay, and she does have a gag reflex present. Also, can you stretch your tongue out? And could you move it side to side? And that also is an examination of those cranial nerves. You'll be able to identify those nerves. And if there was a stroke, it will tell you if the tongue is actually deviated to one side, which side is affected. Okay, so now we would be doing our neck exam, and then we will be moving forward to our nodes, okay, our lymph nodes. So I'll be inspecting her neck. I'll be looking to see if her trachea is deviated or not, if there was any growth or swelling, concern for the thyroid or goiter present, and I'll just be slightly palpating her neck. Okay, and I'll also be feeling to see if the trachea is not deviated, and currently it is not deviating. I am going to get you some water because I want to actually check your thyroid gland. And it's really easier to look at the thyroid gland and examine it and feel it move up and down and the size when somebody actually drinks something. So I'm going to ask you just to slightly pivot a little bit. Okay, and I'm going to go right behind her, and I'll be able to feel her thyroid gland, and I'm palpating her thyroids. And could you drink some water for me? Okay, and as she drinks the water and swallow, you could feel the thyroid glands move up and down. Okay, thank you very much. All right, I just want to do range of motion of your neck. Could you do the movement from side to side for me, left to right? Could you hyperextend your neck and actually touch your chin? Can you do your ear to shoulder? Okay, thank you. And is there any tenderness, restriction,
No.
pain? Okay, so that's range of motion of the neck. I'm now going to move down to slightly in your neck. I would like you to lie a little bit for this, so I'm going to ask you to lie. I'm going to put the pillow on this side because I'm going to examine her jugular vein. And in examining her jugular vein, I'm going to bring it closer. I'm going to have her look to the wall for me as I examine the jugular vein. And in examining the jugular vein, we'll be looking for pulsation. And if this person did have actually did have active pulsation or a distended jugular vein, we would be able to identify it. I am going to check her carotid, and I'll be palpating one at a time. Okay. And we'll be palpating her jugular vein, and it's actually positive to equal. And I am going to auscultate. There is no True. There is no thrills and palpation of the carotid arteries. I am going to auscultate to see if there's a brewery present. I'm going to be listening with my diaphragm and then my bell. So I'm going to auscultate with the diaphragm and then the bell. Okay. Okay. And there is no brewery at this time. As she's lying, I'm going to move down to the exam of the chest. And with this exam of the chest, I will be looking to see if there's rise and fall of the chest, if there's any increased work of breathing, any use of accessory muscles, and currently there is none. Okay, no increased work of breathing. Earlier I got vital signs which were normal, and her weight actually was normal. It has not changed since her last visit. Her blood pressure was within normal limits. It was 130/90. Her heart rate was 68. Her respiratory rate was 20. Her temperature was 36.6. Her height is 5'4", 5 feet 4 inches. Her weight is 163 and is unchanged from last physical. Now moving forward, I am actually going to palpate just to see if there's any free trapped air. Okay, and I'm going to be able to do this more. If this patient was a real patient, we'll have them change into a gown to do an exam of the anterior thoracic. Now I am going to auscultate for breath sounds, and I'll be auscultating her right upper lobe, left upper lobe, left lower lobe, medial lobe, and her left lower lobes. Okay, and I'll be auscultating. And I'm seeing as I'm auscultating, her chest is rising and falling. It's symmetric. There's no labor in breathing, which is excellent. Okay, and now I am going to actually percuss in between the rib cage, and I'll be looking for if there was any dullness. It would be a consideration to see if there was a concern for a rib fracture or overgrowth of tissue or a trauma. Do you have any tenderness while I palpated or percussed?
No.
Okay. Now I'm going to be asking you to do your anterior. Could you sit up for me? Just sit forward. Posterior. I did completed your anterior, and I am going to be moving this way so you could see me, and I would be looking at her chest, how it expands. I'll be looking to see if there was any lesions on the back, if there was any scars, any surgical wounds, if the cavity is expanding symmetrically, and I would be palpating to see if there was any tenderness. Okay, and I'm just gonna auscultate right and left upper lobes, middle lobes, right and left lower lobes. And breath sounds are clear, equal bilaterally, anterior and posterior. I'm going to feel for where her 10th rib is, and I'm going to ask you to take a deep breath in and out for me. And I could feel as she gave her breath in, my hands expanded when she took her breath in, and it came back when she exhaled. So when she inhaled, it expanded, and exhaled, and both right and left moved together, and she was able to take a full breath to her capacity. So currently I want to feel for vibrations and sounds of the chest cavity. Could you say 99 for me?
99.
Okay. Say 99 for me.
99.
Could you say 99 for me?
99.
And I'm just going to do the same.
99. 99.
And feeling the vibration, you'll be able to identify if there was any consolidation, if there was one vibrating less than the other, and that would be what we would call Timus formatis. Okay, and we would be able to identify if this patient had some form of consolidation, or one side is higher than the other, would be a concern for consolidation. Okay, and now I'm going to ask you to lay back so I can do a cardiovascular exam on you. Okay, make yourself comfortable. And I'm going to proceed to a cardiovascular exam. And what I'm going to do is inspect the chest and see if I can see any pulsations, if there's any lesions, of course, if there was any abnormalities in her chest cavity or also the rib cage. I will be actually palpating the intercostal spaces, and I'll be also feeling to see if there was any lifts, if there was any trills that I can palpate as I am palpating the intercostal spaces. Now I am going to palpate her. I'm just gonna lift your breast slightly, okay? And I'm gonna palpate apical pulse. We cannot really palpate the cardiac borders, but we will be able to feel her apical pulse, and it's the apical pulsation, to be precise. Now I'm going to auscultate her heart tones and songs, and we will be doing that with the bell and the diaphragm. I'm going to be moving for the aortic at the second intercostal space on the right, and then I'll be moving to the second intercostal space on the left for the pulmonic. Then I'll be going at the third and fourth intercostal space for the earth's point. Then I'll be moving down to the fifth intercostal space, well, fifth intercostal space for your tricuspid, and then fifth intercostal space mid clavicle line for your PMI and your mitral valve, which is the apex of the heart. And I will start. Okay, and now I'm going to switch to the bell. Okay, and just for privacy purposes, why I didn't lift her shirt and exposed her. Okay, but normally would have your patient actually get undressed in a gown, expose the area that you need to be able to get your exam as needed. You can always have the person lay on the side if you cannot palpate the apical impulse. You can also have the person lift their breast if it's uncomfortable to you. This is somebody that is comfortable with me, so I was able to do that. But in your patient, it'd be easier to ask them so it's not awkward. All right, so now I am going to be moving into the abdominal, and in her case, I can actually lift to see her abdomen, and I'm going to move back so you'll be able to see her abdomen and bring it closer. So I'll be looking at her abdomen. I'll be looking to see if it was symmetric. Okay, I'll be pulling down a little bit to see if we could be able to see and identify her abdomen. We'll be looking for any lesions, any surgical wounds, any abnormality, if there was a ascites present. Okay. Currently, I am going to be dividing her abdomen into 4 quadrants so I can now auscultate her bowel sounds. And this I would be doing with the diaphragm. And a person that had surgery or may have had anesthesia, you may have to listen and auscultate bowel sounds anywhere from 3 to 5 minutes. In her case, her bowel sounds are normal, active, and audible. You can actually hear it when you auscultate within one or a few seconds. I'm going to be listening to her vascular sounds. I'm going to be listening to the aortic artery, the aorta. I'll be listening to her renal and iliac arteries, and I'll be listening to the femoral artery. I would be also doing this with the diaphragm and the bell in order to obtain, to see if there's any bruits. Okay. I'm just gonna move this down a little bit. And then I'm gonna move this side. And one more time over here. And then down to the femoral. Okay. And you try to compare everything from one side to the next. So it would be the aorta, and then you would move to the iliac, then you would move to, the renal, okay, and then you would move to the femoral. And currently there are no bruits. For a patient that you really need to examine, you would really have them undress into a gown so you could actually be able to have this area free to examine. I am now going to light palpation of the 4 quadrants, and I'll be just doing light palpation just for her to get accustomed to the temperature of my hands, just to kind of feel if there was any tenderness. Okay. And I'm going to move now into deep palpation. Do you have any tenderness? Do you have any tenderness?
No.
No. Okay, no problem. And now I'll be doing deep palpation of all 4 quadrants. Okay. And I'll be palpating also for the liver. and the spleen. I auscultated over the liver area and the spleen area to see if there was any rubbing. No rubbing was present. I am now going to actually do the palpation of the aorta just to be able to get a sense of what the diameter, and also if there was any malformation or if there's any trills. So I'm going to just palpate. Okay. Okay, and the iliac artery. Okay. And then I'm going to palpate her femoral pulse one at a time. Okay. And I'll be able to palpate her femoral pulses one at a time. And her femoral pulse is actually equal, +2, with a normal rhythm. Okay, so I'm going to now, and this, I'm going to now move into her extremities. And I'm going to be only working on this side just because we do not have a full bed. And with this, I'll be looking at her upper extremities. And I'll be actually inspecting the skin. And I'll be looking to see if there was any lesions present. If there was any injury, scar tissue. If there was any edema present. If there was rashes and stuff. Now I'm going to be moving down to her hands, and now I'm actually going to now palpate the joints to see if there was any malformation, if there was any tenderness. For instance, if she had like rheumatoid arthritis and there was deviated joints or swollen joints or tenderness. I'm going to be palpating her wrist to see if there was any tenderness, if there was any pain, if there was any deformity. And I'll be moving up to the elbow, and I'll be also inspecting the elbow to see if there was any changes in color, pain, discomfort, if it was looking like there was a deformity or not. And I now would go up to the shoulder and the shoulder head, clavicle, palpate and come in with the scapula joining to the clavicle. Okay, and at the same time as I'm palpating, I would also palpate here, which would give you the axillary nodes. Okay, so now I would ask you to could you open your eyes and follow me? Your fingers, I want you to bring them like this, open them, so you adducting your fingers, and then you bring it together, abduct and adduct. All right, could you make a fist? Okay, and I'm just going to stretch for strength. At this time you would do 2 hands, so I'm just going to actually have you make a fist. And could you squeeze real tight? Okay, and could you push against me? Are we checking muscle strength, of course, and I'm going to be pulling down, so could you not let me pull down? Okay, I'm good. I'm going to be pushing up. Could you not let me push up? Okay, and that would be testing the muscle strength. And could you stretch your arms out like this for me? And that would be shoulder strength. I will be testing, and I'm going to push down and don't let me push down. And I'm going to push up and don't let me push up. Okay, and while you're here, could you actually abduct, which is away from the body? Okay, and adduct. Okay, could you flex your shoulders in for me and extend them? Okay, and could you rotate this hand like this for me in a circular motion? Very good. And could you extend to the back? Okay, and then could you bring it all the way back for me? Okay, and is there any tenderness?
No.
Okay, and any pain when doing these movements?
No.
Okay, thank you. Now I'm going to actually look to see at your cap refill. Okay, good cap refill, less than 2 seconds. Gonna palpate her radial pulse. Okay, and it's +2 and equal. I'm going to now go to her brachial pulse. And then I'm gonna actually move now into your reflexes. Do you mind sitting up for me? Okay. All right. You can sit like this. It's totally fine. So I'm just gonna get my hammer, reflex hammer. And with my reflex hammer, I am going to let me have you lay your hands like this. Just relax. And I'm gonna be checking her reflex of her brachioradialis. Okay. And I would be slightly palpating, and it would slightly see it, and it jumped, and you could see that, and you would do it so that you could see the reflex of the thumb, the hands, and stuff like that. Okay. And now I'm going to be going to her brachial, and I'm just going to be lightly supporting her brachial. Okay. And I just want you to relax, let it to be. Okay. And I'm going to slightly, and you see it jump. Okay. Now I'm going to be doing your tricep. Okay. And it's slightly to the back here. Okay. And you saw the jump. If you want to see, okay, so you saw the jump. So that was the tricep. This was the bicep reflex, and the brachioradialis reflex. Okay. Okay. Right. So I wanted to actually go back and check your nodes. Since I check your axillary nodes, I would do it bilaterally, but I wanted to check your lymph nodes on your face and neck. So I am going to now palpate your temporal arteries. Okay, and could you move your jaw for me? And okay, good. And could you like smile? And that's cranial nerve 6. Okay, I mean 7. Okay, and that would be checking to see the facial movement. If somebody had a facial paralysis, you could see it when they smile or try to move their face. I'm gonna do your pre-auricular, okay, post-auricular. All right, I'll be moving down to your mandibular lymph nodes, then your tonsil, okay, then your mental, submental lymph nodes, and then I'll be moving down to your anterior cervical, and then your posterior cervical, then to your subclavicle. Okay. All right. And when you palpate a node, you want to see if there's any firmness, tenderness on palpation, and if there is actually bigger than say a quarter, and that would be a concern. Okay, thank you. I'm now going to be moving into your spinal exam. Do you mind standing for me? Okay, thank you. I'm just going to move this backward a little bit. Okay, and I'm going to have you turn. So I'll be inspecting her back to see her alignment. Could you raise your shoulders for me? Try to move it. All right, good. And I'll be checking to see the alignment of the shoulder. Okay, I'm going to actually look at her hip bone and palpate and actually put on the iliac crest to make sure it's symmetric. Now her hip needs to be symmetric to see if there was abnormality of growth, one longer than the other of the lower extremities. I'm going to ask you to see if you can bend over to touch your toes like. And in this case, we'll be looking at the spine, which I'm going to bring, and you'll be looking and palpating to see if there was any sign of a scoliosis, a deviated S-like shape, or one side higher than the other, and that will be a concern for mild scoliosis. Okay, so you'll be checking for that, or moderate, that you cannot see when the person is actually standing straight. You could lean forward. So that was flexing of the spine, and you could actually lean back slightly, and extension of the spine. I'm going to ask you to move to your left for me. Lean to your left. Okay. And lean to your right. Okay. And any tenderness?
No.
All right. And could you do a slight twist to your left and then a twist to your right? And that's actually checking the spine and hip together to see if there was any tenderness. If somebody had like a disc that was slipped, they couldn't make the rotation of the spine. Okay, and the flexion or extension. Okay. All right, so I'm gonna have you sit for me. And I am going to perform the lower extremities. I want to actually look at the lower extremities, feel for warmth to the touch, look to see if there's any lesions, if there's any old scars, if there was any mask, if there was any bruises, and I'll be going with that. What I'm going to do is actually ask you to lay so I can actually do my exam of the lower spine, and I'm gonna, not the lower spine, the lower extremities, and I'm gonna ask you if you can. Okay, so I will start with the toes. Okay, and with the toes I am actually going to be asking you to push against me. Okay, and could you, I'm palpating. Okay, and you will do this bilaterally, but I'm currently working on one just because I don't have the space for the other one. And I'll be looking at her ankles. Okay, and one of the things you look for with ankles is for swelling, like edema, tenderness, if there is proper rotation or not. And then I'm moving up to her leg. And currently you could actually look and see that there is hair, which means good perfusion on the leg all down to the toe. In a person that has no hair on their legs, it might be shiny. It's a concern for peripheral vascular disease. So in patients like that, you really want to check in between their toes. You want to look at capri fill to see if the color, if it is warm to the touch, and things like that. Moving up, I'm going to ask you, can you flex your toes for me and extend them backwards? Okay, could you rotate your ankle for me? Okay, and any tenderness or pain when doing so?
No.
Okay, I'm gonna ask you if you can bring your knees up to your chest. Okay, and could you bring them down? Could you slightly do this for me? I wanna abduct your feet. Could you bring it out this way, away from the body? And this is for the hip. And now we're going to actually ask you to turn slightly, and I'm going to ask you to flex, which is bring it to your knees to your chest in that perspective as much as you can. Could you bring it? Okay, so that was the flexion and extension of the hip, and also the abduction and adduction of the hip and joint. Okay, for your knees I did the flexion, but I want to do the extension. So could you bring it back for me? Okay, good, and extend it. Good. All right, I'm gonna get a taller chair because I want to check your reflexes of your knee. But before we do that, I just want to be able to actually check your dorsalis pedis pulse, which is +2 with a good rhythm. Okay, on palpation, and your posterior tibia, and this is +1, and it's equal with a normal rhythm. And I'm gonna slightly ask you to relax your legs for me as I palpate your popliteal pulse. Okay, okay, and that's a +2, and it's equal with normal rhythm. Okay, as you're laying there and you're comfortable, close your eyes for me. I'm just going to actually do sensory. So for sensory wise, could you tell me what I'm touching you with? Is it soft or pointy?
Pointed. 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 So.
Okay, and can I do your arms?
So. Thank you.
And you always want to check to see if they can feel things, because patients that are diabetic, they may step on something and they lose their sensation. It's a very great concern that they may have neuropathy, okay, or neuropathic pain as well. So you want to be able to identify that in the early stages of your exam before they actually have chronic pain or loss of sensation totally. I'm just gonna be able to identify the Babinski since I have you sitting before I start reflexes of your knee, and I'm going to ask you to relax your legs for me, keep it up like this, and I'm going to, okay, and that's a normal reflex. When you put the hand, the person's toes go in. If it went like this, there'll be a concern for some trauma in the brain. It is actually normal in the pediatric patient to actually flex with when you touch their feet. I'm just gonna get a tall chair so I can do your patella and Achilles tendon reflex. Okay, I'm just gonna ask you if you could sit here for me. Okay, make yourself comfortable. Okay, thank you. All right, and just dangle this leg for me. Okay, and just relax. Just relax. Okay, and we'll be examining the knee, of course, and the tendon is right here, and you would actually go like this and look to see if the leg jumps. Okay, all right, and then I would be moving down to the Achilles tendon, and I'll be looking to see at the back where the tendon is, to see if there is some flexion. Okay, and that would be identifying if you were able to get a good reflex from those tendons. Okay, and this concludes for us the examination of a head-to-toe exam. Thank you very much. Thank you. Have a great day.